Hi, I'm Stevens Mundy, CEO and President of the University of Vermont Health Network, Champlain Valley Physicians Hospital, part of the UVM Health Network. I want to welcome you to CVPH and share with you some basic information you may find helpful during your stay with us. CVPH has a proud history of caring for the people of the North Country. We are the living legacy of William H. Miner, entrepreneur, visionary, farmer, and philanthropist. He set a new standard of care for the North Country when he opened Physicians Hospital at this location in the early 1920s. While much has changed over the years, there continues to be one constant: our commitment to providing you with the highest quality care in an environment that supports your health and healing. The video you're about to see is designed to cover a range of practices and services at CVPH that you'll experience during your stay with us. At CVPH, thousands of employees in hundreds of different jobs all share a single goal: to provide you with the best care possible. We understand being here may be stressful, but rest assured, everything you see happening around you is being done for a reason. If you ever have any question about any aspect of your treatment, please ask. I personally guarantee that if a CVPH staff member doesn't know the answer, they will find someone who does. Thank you for trusting us with your healthcare. We'll do everything possible to keep earning that trust. Now let's take a look and see what's behind patient care here.
Sometimes in medicine, things sound complicated. So if there are any terms you are not sure about, please ask your caregiver and he or she will be happy to explain. You'll hear the term hourly rounding. Simply, this means a caregiver will be checking in on you at least once an hour. If you need anything in between these hourly rounds, contact the nursing station by pushing your call button. Take advantage of check-ins to ask questions and make requests. If you need a hand to get up or to use the bathroom, it's the perfect time to ask. Write your questions down. That way you're prepared to get answers. You'll get to know the staff, including doctors, nurses, and aides. During shift change, there's an organized way information is carefully handed off to the next team member, and it happens directly in front of you. You'll hear and see this exchange, so please feel free to be a part of it. Your specific care goals and plan will be reviewed to make a seamless transition between shifts. You'll see on your own whiteboard, located on the wall in front of you, updates and clearly stated care goals. The names of your nurses, care assistant, and housekeeper will be there, as well as dietary information, mobility status, and goals. Daily, volunteers will visit your floor with our Cart with a Heart. You'll find a nice variety of items on the cart, including magazines, newspapers, some personal items, and snacks. We understand that caring for the spirit is as important as caring for the body. Offering spiritual support are the Reverend Robert Bassam, Hospital Chaplain, and Father William Reamer, Roman Catholic Chaplain. You can also request a visit for any clergy of your choice by speaking with your nurse. Pain management and medication safety are our priorities. You have the right to pain management. You'll be informed of its role in your care with full explanations about pain and pain relief measures. We need to understand what pain you're experiencing and the history of that pain. Our goal is to deliver the right medicine in the right amount. If you have questions your nurse can't answer, they'll contact a CVPH pharmacy team member. Pharmacists routinely consult with medical staff on your floor from 9 to 3 during the day, and the pharmacy is staffed 24 hours a day. Rapid response is available anytime you or a family member feel your condition is worsening and an urgent response is necessary. Anyone can call a rapid response by dialing 0 on any hospital phone. Rapid response team specialists include a critical care RN, a respiratory therapist, and a member of the leadership team. We hope you won't need to experience this level of urgent care, but it is available if necessary. Support from friends and family during your stay is important at CVPH, and you have the right to have visitors or not have visitors. It's your choice, and unless there is a restrictive medical circumstance, visitors are welcome anytime. From 5 a.m. to 9 p.m., your visitors will use the front lobby. After 9 p.m., visitors access the hospital through the emergency department, obtaining a pass and an escort. Visitors under the age of 12 must be accompanied by an adult. Labor, Delivery and Recovery Suite, Mother-Baby Unit, Pediatrics, Nursery, Behavioral Health, Intensive Care, and Surgical Waiting Areas all have special visitor regulations. We work continuously to reduce noise and provide a quiet environment for you to rest and heal. Where possible, lights are turned lower, doors are closed, and voices lowered. If you would like, CVPH will provide you with earplugs, headphones, or an eye mask. Our staff will also respond quickly to pump alarms and call requests to make sure you rest as comfortable as possible. It's everyone's job to keep noise down. It's also everyone's job to control infections. Patients, healthcare workers, visitors, everyone needs to take extra steps to thoroughly wash their hands and use common sense with hygiene. You'll see workers washing their hands often, and it's important you always wash your hands after using the bathroom, before eating, and after any contact with visitors. Make sure your visitors wash their hands. It's for everyone's protection. If you experience dry skin, ask for hand lotion. When the environmental services team cleans your room, please help them by letting them do a thorough job. It only takes a short amount of time, but those minutes are critical in killing germs and controlling infections. CVPH is a smoke-free campus, including electronic cigarettes. If you need help to not smoke, even for a short period, please ask. Help is available. Speaking of help, did you know you have an advocate here at the hospital? Patient advocates work at CVPH but act as a neutral party. The patient advocate is here to help you with any issue not resolved to your satisfaction by the medical or administrative staff. The patient advocate is here to listen confidentially and to act proactively to resolve issues. Patients at risk of falling receive special attention through visual signs on doors, wristbands, and special socks. This may also mean additional protective equipment may be in the room. Volunteers may also visit your room in an effort to reduce falls. They'll check to be sure your call button is easily accessible and that there are no cords or equipment in your way. A healthcare worker may discuss the importance of ambulation with you and your family. Ambulation is a medical term that simply means moving around. Ambulation improves patient outcomes and allows for discharge sooner. To help you easily identify caregivers, CVPH staff uniforms are color-coded. For example, RNs and LPNs are in navy or white. Clinical assistants wear brown or khaki. There are a number of colors for various jobs, and we don't expect you to memorize them, but please note all staff is clearly identified with CVPH credentials. All of us wear an ID badge helping you identify us and where we work. While at CVPH, you may be treated by a doctor who is new to you. CVPH has an entire staff of doctors ranging from general practitioners to specialists that work exclusively at CVPH. They are known as hospitalists. Hospitalists are physicians who practice exclusively within the hospital and are available 24 hours a day, 7 days a week. They work closely with your primary physician and other specialty providers during your stay. You may meet additional medical professionals during interdisciplinary rounds. Interdisciplinary means departments that are different but that work together. These may range from caseworkers, pharmacists, physical therapists, occupational therapists, to nurses and doctors who all participate in patient care by discussing treatment, medication, and outcomes. Your plan of care and discharge is reviewed constantly by your team of caregivers. Discharge planning actually begins when you are admitted. Throughout your stay, you'll be followed carefully by a case manager. As part of your healthcare team, the case manager will facilitate your transition out of the hospital. Close attention will be paid to communicating your discharge plan, including follow-up appointments and making initial contact with any community agencies who may be helpful to you during the next phase of your recovery.
Our staff is deeply committed to your care and the needs of your family. Delivering personal, compassionate care is a standard we strive for every day. We hope this video has provided explanations regarding your experience here at Champlain Valley Physicians Hospital. Feel free to ask questions about any part of your hospital stay or your transition home and follow-up care. If there's anything we can do to make your time with us more comfortable, please don't hesitate to ask. Thank you.